As part of the government's healthcare reform, the authorities have outlined plans to inject funds worth $2.5 billion annually so that large hospitals can better focus on taking care of critically ill patients. Shin Ha-young has the details.
The government will launch a pilot program next month to reform tertiary care general hospitals, prioritizing the treatment of critically ill patients. According to the plan announced by the Health Ministry on Friday, hospitals participating in the program will need to increase the proportion of high-level treatments, such as those for critically ill patients and rare diseases.
The government will restructure tertiary care general hospitals to focus more on treating critical, emergency, and rare diseases, gradually increasing the share of high-level treatments from 50% to 70%.
The number of hospital beds for patients with mild conditions will be reduced by between 5 and 15%, depending on region. To help participating tertiary hospitals transition smoothly, the government plans to invest 3.3 trillion Korean won, or around $2.5 billion of its health insurance funding annually, amounting to 10 trillion won, or about $7.6 billion over 3 years. The government has also decided to increase fees for 910 critical surgeries and raise fees for intensive care units by 50%. It stated that even with the fee increases, patients will not have to pay more during emergency care.
Patients won't have to pay extra during the emergency care period. We also plan to make sure that patients with severe conditions won't face extra charges after the emergency care period ends.
The government plans to improve the critical patient classification system to clarify what counts as critical. Instead of solely relying on the diagnosis, this new system will consider factors like patient's age and health condition. Shin Ha-young, Arirang News.